Good evening, and thank you for joining us on this Friday. We are learning tonight this pandemic is far from over. Researchers from the University of Minnesota now say the outbreak is likely to last as long as 2 years and won't be controlled until 2/3 of the world's population is immune. That new warning comes as anger is growing across the country. Americans frustrated by weeks of staying at home took to the streets today, protesting in states that still have social distancing orders. Elsewhere, healthcare workers demanded more protective equipment, and Amazon employees protested conditions in the company's warehouses. COVID-19 has now killed more than 64,000 people in this country. But even as cases continue to rise, 36 states are now easing restrictions. Not one of those states has met the federal guidelines to reopen. Those rules require seeing a decrease of cases for 14 days. And as we come on the air tonight, the FDA says it is approving the Ebola drug remdesivir for emergency use for COVID-19 patients in hospitals. Initial testing shows the drug helps shorten the recovery time, and Vice President Mike Pence says 1.5 million vials will start going out to hospitals on Monday. Our team of correspondents has all of this news covered tonight, and CBS's Janet Shamlian will lead us off in Houston. Janet?
Nora, frustration over those stay-at-home orders turned into more angry protests today, even as a number of states eased restrictions, opening restaurants, retail, and other businesses. But as they did so, the number of COVID cases and deaths started hitting new highs in places like Texas. And some medical experts say it could be a dangerous move.
Tonight, a rising tide of anger. Protests erupting in Chicago over stay-at-home orders. Similar frustration boiling over in Charlotte, North Carolina.
Workers of the world unite!
Amazon workers in New York also protesting on this May Day.
I'm not risking my life to come back in this warehouse right now.
It comes after demonstrators, some with assault rifles, marched in Michigan Thursday, upset by extended restrictions.
Yesterday's scene at the Capitol was disturbing, to be quite honest. Swastikas and Confederate flags, nooses, and automatic rifles do not represent who we are as Michiganders.
Late this afternoon, progress in possible treatment. Citing its emergency use power, the FDA approved the experimental antiviral drug remdesivir to be used in more patients. An NIH study showed it could reduce recovery time. The drug's manufacturer, Gilead, is donating 1.5 million doses as early as Monday.
It's really a very promising situation. We've been doing work with the teams at the FDA, NIH, and Gilead.
The news comes as 36 states have now loosened restrictions.
For here or to go?
Texas reopened retail and restaurants like Houston's Common Bond at 25% capacity today, even though the state Thursday reported its single-day record in new virus deaths.
When you opened the door this morning, were there any customers there?
We've only had about 5 or 6 tables, people that have actually dined in.
The easing of restrictions has some health experts frustrated.
Once again, we have squandered the time that we had. We haven't necessarily set up the right detection systems and the right surveillance systems over the last couple of months.
After California's governor closed beaches in Orange County, local leaders are vowing to push back. And angry crowds gathered at one beach, demanding he reverse course. Across the country, infections continue to spike. Maryland and Virginia today reported their highest one-day increase in cases. The pandemic continues to provide stark reminders of its highs and lows. The death of 66-year-old Colorado paramedic Paul Carey after volunteering to treat patients in New York. And sheer joy as the last patient was released from the Javits Convention Center Field Hospital, serenaded by applause and bagpipes.
And as restrictions are easing here in Texas and elsewhere, a large number of businesses are deciding not to reopen, saying they are simply not ready yet. Nora?
All right, Janet, thank you.